Hi everyone, my name is Nora Barras. I'm a Master of Public Health student here at Wayne State. And as part of a series, we'll be going over anxiety. And today we'll just be doing an introduction. So just a brief outline of the presentation for today. I'll be going over what anxiety is, how it's linked to stress, the causes of that stress and anxiety, and then how it can affect us as students. And then finally, I'll be going over some on-campus and off-campus resources for you to use. So just a brief start on anxiety. So what is it exactly? It's a feeling that includes feelings of worry, tension, and uncertainty. We all know anxiety can be an inevitable part of life. We tend to feel anxious, some more often than the others, of course. There's many situations in which in our everyday life where it's reasonable for us to react with anxiety, with feelings of anxiety. And anxiety is actually one of the top mental health concerns facing college students in the United States. There was a study done by the Healthy Minds over at the University of Michigan that showed 36% of US college students have reported some sort of anxiety disorder. There are different types of anxiety. This is not an exhaustive list. These are just pretty common ones. So we have anticipatory anxiety, social anxiety, separation anxiety, and then this last one, test-taking anxiety, we actually will be going over in another webinar as well in this series. Also keep in mind, feelings of anxiety are not the same as actually having an anxiety disorder. But if you're having symptoms that are lasting 6 months or more and are getting in the way of how you normally function, then there is a possibility that you do need professional help. So how are stress and anxiety linked? Although they do have some similarities, they also do have their differences. Stress is a part of our life, and everybody struggles with their worries and anxieties at times. Stress will trigger our fight or flight response. But on the other hand, anxiety can be a secondary stress response. And it's usually experienced as fear, which is on the more mild side, and then also dread, which is on the more severe side. And to add to that, stress is a natural response to our feelings when we get overwhelmed. It can also be a response to positive changes in our life. And with stress, there can also be a physical response. So we might see, temporarily high blood pressure, tighter muscles, sweating, or just being on high alert. And then when it comes to anxiety, it's basically just like triggering this false alarm. So if that response outlasts the situation, that's causing the response. So it's kind of just lingering. And while stress and anxiety are both products of the same chain of events, and they do create similar effects in the body, anxiety can have a broader reach. So stress is a physiological response, but anxiety is also psychological in nature. So prolonged exposure to our stressors can increase your risk of developing anxiety or an anxious disorder. So here are a few common causes of stress and anxiety within college students specifically. Of course, there are academic factors like, pressure to do well in our classes, whether that's coming from a professor or a family member or anybody else. There's feelings of loneliness, which are kind of tied to moving away from home, especially if you live in the dorms, or you're coming from out of state, things like that. We have new social situations, financial stressors. We know that college can be pretty expensive when it comes to our tuition, room and board, textbooks, things of that sort. We do have increased responsibilities, so we're kind of trying to balance like classes with work, with volunteering, and other things of that sort. We can have a lack of good time management. It can be difficult for us to manage our time wisely, especially as freshmen. We have changes in eating and sleeping habits. So if you see yourself pulling an all-nighter to study, if you're not taking enough breaks for self-care, and then also just having that sleep disruption, so kind of tied to the changes in sleeping habits. So that sleep disruption can be caused by drinking too much caffeine, and like I mentioned earlier, pulling those all-nighters. And then we do know that the pandemic did have a big effect on us as college students as well, mostly because of the isolation of having to just work on, like, study online and I guess attend our classes online as well. And then that lack of social support. And then, of course, there's going to be effects of stress and anxiety on us as students. Just a few short-term impacts, we'll see ourselves having a reduced motivation, an inability to maintain focus, so to actually pay attention and stay concentrated in our classes or when we're taking a test, things like that. Also, when we're missing classes or assignments, we have disrupted sleep, so that'll just be a cycle because um, like we mentioned earlier, if you're drinking a lot of caffeine, we're not sleeping as well, then this will end up happening. You have worse mental well-being overall, and increased use of substances such as drugs and alcohol. And then the long-term impacts, which are really important to mention, are your increased risk of developing mental illness like depression and then anxiety, and then your increased risk of developing a sleep disorder, so something like insomnia. Here are a list of mental health resources on campus that you can take a look at. I highly suggest that if you find yourself having trouble in college. So, and then here are some national mental health resources if you'd like to read up on them a little bit more as well. I suggest that you pause here and screenshot this page. And then I do need to mention, if you feel that you are having a mental health emergency, you should call Wayne State's police if you're on campus. CAPS also has their after-hours crisis line, so you could always call that. But if you are off campus, then just go ahead and call and dial 911 or go to the nearest hospital emergency room. Some other options during a crisis, the 988, which is the National Suicide and Crisis Lifeline, and then you can also text at 741-741 to reach a crisis counselor. And then just to keep in mind, the campus health center does have a social worker on staff that can help you with counseling. So you can just make an appointment online at health.wayne.edu, or you can go ahead and call us as well. And then if you do want to reach out to us, here are our contact information. And here are my references. Thank you.